One of my really close family members was diagnosed with chronic leukemia. And then I knew I wanted to do oncology. So I treat leukemia and myeloid disorders. So a lot of patients have MDS or AML, also chronic leukemias like CML. In addition, bone marrow failure disorders. A first visit with a patient is very comprehensive. Usually the work has started on the back end even before we see the patient in general. There's a lot of notes that we review. The pathology is requested for our pathologist to get reviewed. And then the first visit is for me to get to know the patient and the patient to get to know me in general. So a lot of history taking, we ask a lot of questions, we hear their stories. A lot of work then goes into finding out what diagnosis they came in with is correct, and if not, what could be an alternate differential diagnosis and what treatment plan we can come up with. In leukemia and myeloid disorders, a lot of times patients will present with low blood counts. So low hemoglobin, which we also call anemia, low neutrophils, or low white count called neutropenia or leukopenia, and then low platelets. When all three blood cell lines are low, we call it pancytopenia. And that's what most of our patients present with. And I make it a point to discuss with our patients how our bone marrow, which is the factory of our blood cells, makes all these three blood cell lines. So low hemoglobin or anemia can cause our patients to have tiredness, shortness of breath. They feel tired at less than accustomed activity. If they have low white counts, they can get infections or recurrent infections. Sometimes they're in the hospital for these infections, which can become severe or serious. And then low platelets can cause bleeding or bruising. So the treatment plan is very dependent on what the diagnosis is. In chronic leukemias, we actually have pills that can treat patients now. I usually like to tell my patients that this is kind of like having high blood pressure or diabetes. In more acute leukemias, the treatment plan usually would require chemotherapy, which could be intensive or non-intensive. Intensive treatment can require hospitalization, and non-intensive treatment we try to do from the comfort of the patient's home. We see these patients for years on end. For example, with chronic leukemias, we see them once in 3 months for the rest of their life sometimes. So we see, them having kids or their kids growing up, their kids getting married. We tailor appointments according to their personal schedules. And it's really nice to take this journey with them.